Yo, welcome back in, all you DPC rebels and resistant fighters. Drshane back with another Friday 5-minute magic tip. Hope you guys are looking forward to a great weekend. Just wanted to recap just quickly. Last week we talked about the South Carolina Medical Affairs scope of practice hearing. Went over a few things on that and the position that physicians have found themselves in. And just want to piggyback off of that on a part two of that discussion. Uh, Last week we called it "Docs Only Have Ourselves to Blame." So the question is now, what? Where are we headed? What can we do? Uh, is there a safe way we can expand access to care? How do we do that? What would that look like? So some ideas I was thinking of as I was listening to the medical affairs discussions between the senators and all the folks who talked about, who were interviewing and giving their stories, was a lot of interesting communications, ideas, things like that. So it was very helpful to learn. So I had a few thoughts about that, about how we could possibly expand. Um, so they're already talking about ways to increase the training hours. So in this, one of the bills the nurse practitioners have uh, agreed to 4,000 hours of supervised training before independence could be gained, uh, which is a significant amount of training. That's about half the hours that a family physician would get in a 3-year residency. So maybe we consider doubling those hours. So you would work about 8,000 hours, which would be about 4 years of supervised training, roughly, uh, for nurse practitioners, PAs, before you can achieve independence. So the training would be similar to primary care residency program. Uh, so 4 years of supervised training, is that something we should consider, or the senators should consider a longer supervised training with some real, genuine supervision uh, that could be done to improve uh, the safety of long-term independence. So that's something to think about. I would consider making independence for primary care only. There's some debate in these bills about if you do primary care for a while, you can switch and do work with a rheumatologist for a certain amount of hours, and then you can work independently in rheumatology, dermatology, um, cardiology. I would really restrict the limitations on specialty care. Uh, I don't know, it would be thousands and thousands and thousands of hours that it would take to gain the knowledge of our specialty residency. So I would put this limitation for independence only for primary care. They consistently complain about the shortage of primary care physicians in the state of South Carolina and in rural areas. So if that's the case, let's mandate that independence is for primary care practice only. Um, and speaking of work shortage areas and rural areas and places where we can't get physicians, maybe we tie independent practice to serving in those shortage areas or rural areas. Is that a possibility where if you're going to work independent practice as a PA nurse practitioner, maybe where it's required that you work in those rural areas to work independently? Um, that would be, something to consider. If we're going to really focus on trying to help the rural areas, maybe that's something we need to do. Um, the biggest thing is my wonder about is the bait and switch type of thing. Yeah, we're going to work in a rural area in primary care, and they do that for a year or two, and then they move to a big city and open up weight loss clinics and Botox clinics, and stop doing primary care altogether. Start doing other things to generate revenue. So that would be something to consider. I don't know how we can limit those down the road. So those are the things that came to my brain as I was thinking, some things that we may consider. Also, some questions that I had as I continued to ponder this over the last few weeks. Some things that came up during the talk at the open hearing. One of the questions is, will physicians drop out of primary care? Are we going to lose physicians in primary care? They're going to stop filling those residencies. If the nurse practitioners and PAs can do the same work, will physicians even choose to do primary care moving forward? The interesting thing, if you go and do research, if you look at AI-generated search queries on several different sources, the states who have independent practice, we don't see this happening. We don't see a decrease in primary care physicians or residency slots or that kind of things. If you do the research, don't really see that happening. Would that be a problem in our state? I don't know. Something that's just a question. Will this independent practice for nurses, nurse practitioners, PAs, will it decrease the amount of nurses we have in our hospitals and outpatient clinics? Will RNs get harder to come by for our hospital systems? There's no evidence of this in the past in other states, but it's a question to think about. One question that did come up that is definitely an issue we need to resolve is, regardless of whether scope practice changes or not, there's supervising issues with nurse practitioners or PAs, specifically if a supervising physician gets sick, dies, or retires on short notice. It leaves the physicians, assistants, and the PAs, the nurse practitioners, in very, very difficult situations where they can't continue to care for their patients. We need definitely a workaround or a fix for that, for sure. Because currently in South Carolina, there's no fix. If your supervising physician dies suddenly, you're just out of luck. You have to find another supervised physician. If it takes you 2 or 3 months to do that, you're basically your patients don't have care. So that's a concern. So where do we go from here? Definitely if you're in the South Carolina area, I would speak to your senators, speak to representatives, get them in your office, share with them how your practice works, share with other independent physicians, try to spread the word about independent practice and scope of practice issues. Certainly if their scope of practice issues are on the board for your state, I would do that as well. Speak to your senators, representatives, try to find out what's going on and how can you help, what information you can provide. Just educate them on the difference between physicians and nurse practitioners, and try to ask the tough questions on how we can move forward. So hopefully this is helpful, and you guys have a great weekend. Try to see you back in a week. Till then, you guys keep the DPC